Good afternoon, class. Welcome back to First Aid CPR AED certification. Right, we are into our, I guess you could say, 11th week now of class, and we've moved everything online. Now, just to let you know, an important day is today, 4/7/2020. It is your last day to withdraw if you're choosing to withdraw from the course. Now, do contact me if you choose to, but go ahead and do this through Registrar. We're going to go ahead and dive into material. Last week we covered injuries to the head, neck, and back. This week, and we also covered, extremities a little bit too. We're going to jump into injuries to the chest, abdomen, and pelvis today. And then once we finish that portion, we'll start the first unit of sudden illnesses. We're looking at fainting spells, diabetic emergencies, asthma attacks, little basic things like that. We'll get into bee stings and whatnot then, perfectly fitting for the weather as it's approaching as well. Let's see. So first, like I said, go ahead and jump in your book. Your book has a section called Injuries to the Chest, Abdomen, and Pelvis. Now these are very important injuries to detect and to call 911 for the severe ones because these pertain to a lot of organs within the human body. When we're looking at the chest, right, we have, first off, within the upper cavity here, okay, we have a cavity that surrounds both the lungs and the heart, okay. If we compromise either of these cavities, right, we could have blood moving places where it's not supposed to be, other fluids going places where they're not supposed to be. We could have impact injuries, we could have all sorts of aspects coming on here. These are the two things that we're always trying to promote. Breathing and circulation. So if we're affecting the heart and the lungs, these are definitely usually reasons to call 911 immediately for. We're going to need further help for this person with an injury like these. Some of these, like I said, they can be very fatal. That's why it's very important that we recognize which ones could be fatal and to do the best care possible in the meantime while we wait for help to arrive. We don't want to cause any further injury, right? These could be impacts then that could also have damages to the neck and spinal cord then too with a chest injury. So we could have multiple injuries going on because, right, we have the spine and there's a portion of the spine that is going past the chest region. So they could all literally be compromised. So general care, right? We call 911 when we recognize that there's a severe injury or severe emergency. That could be, right, a car accident where the person hit their chest against the steering wheel. They're thrown from the vehicle. People are unconscious, not moving in the first place. All reasons to call 911 in the get-go. We want to do a couple major things, though, right? Initiate the emergency medical response system, calling 911. We limit the person's movement. We get them to lay as still as possible because they could be in shock, right, of maybe a lower extremity abdomen injury, and they could be in denial of it happening, and they could just be trying to move along and do something. Get them to relax, get them to stay still, right? Because we need to keep their blood pressure down, keep them as calm as possible, maybe even apply pressure to certain wounds if necessary, like external bleeding, right? Internal bleeding, right? Other little things that we're going to see too. Those we will do other protocols, which we'll get to here. Monitor the person's breathing, right? If we're waiting for help to arrive and we don't see anything else that we can do, right? The person's breathing and the person's maybe coherent for now, right? And we're just staying there in the meantime. We're monitoring their breathing for if they do, we have to perform CPR in the meantime while we're waiting for help to arrive. We can put pressure on those, like I said, control bleeding wounds. Don't give them any water to drink, just reassure them everything's gonna be okay. Keep them from getting overheated, over chilled. For chest injuries now, since we're gonna start here and work our way inferiorly in the body, a little bit lower, these are very serious because I said already, chest injuries are pertaining to the lungs and the heart, the two most important structures we have to sustaining life in the first place. So if there's trouble breathing or there's no breathing, right, these are serious signs or serious signals. If they have severe pain in the chest, if there's a deformity that's obvious, maybe like they did take that chest wound where they hit their steering wheel, the airbag didn't deploy. Look for something caved in. The bones could have gotten broken off the sternum, or any part of the ribs could have gotten broken as well, technically speaking. Look for where their seatbelt was too. That's always common with a chest wound and a wound that goes down to the stomach and across the lap as well. Oftentimes in a car accident, maybe the person's okay from the accident, right? They didn't go flying out of the vehicle, they didn't hit anything, their seatbelt restrained them. But they could have injuries from the seatbelt, they could have injuries from the airbag itself too. It all depends on how it hit them then as well. So we have to look into all the possible reasons on why there's an injury. If somebody's ever coughing up blood, that's pertaining to blood coming from either heart, lungs, or the stomach, abdomen. That's always a bad sign. We call 911 immediately for those two, right? If we ever have a wound to the chest, maybe it's a gunshot wound, knife wound, and we hear a sucking sound coming from that, a distinct sucking sound when the person's breathing, or a sucking noise from just them breathing as well, we want to call 911 for those too. A rib fracture, a lot of times, these can be not too bad overall, right? A lot of times the ribs, when they're broken, they have to heal on their own. They're going to be painful though. Every breath could be painful. The person could be breathing very shallow because the pain is so intense from just, if you take a full breath in, it expands the chest cavity and it makes those ribs pull apart even more. So not fun, right? They're probably hunched over protecting it. The book shows a good picture of how you can help somebody with this one. This is real basic. Maybe give them an ice pack, right, with a towel, and then put a pillow there and have them press it against. You can do a binder with wrapping it around the body, but just having that little bit of pressure can sometimes help the person. Even if you wanted to, you could put them in a sling for the time being to help them relax their body so there's not so much pain. A serious rib fracture is something where the person should go seek medical help later on. Sometimes the ribs can be so severely displaced that they cause, the bones, when they break, they could cause tearing of a structure to the body. So there could be some internal bleeding beyond just a regular bruising. So do look for those signs. The book has a great picture. I think it's a guy in a red t-shirt, and he's got it bound around him, a pillow, and that's going to help with that little bit of pressure. So he's feeling more comfortable, you could say, for the time being. Have them just rest in the most comfortable position possible, really, though, for the time being. That's one of the best things you could do, especially if it's a minor one, or I guess you could say for a major one, too, have them rest in the most comfortable position possible. But for a more of a minor one, try to encourage them to breathe slowly and slow and deeper breaths if possible, as much as they can tolerate. If you suspect that there's a head, neck, or spinal cord injury going along with this rib fracture, right, maybe to the lower back, still, we want to hinder their movement as much as possible, so get them to relax. I'll call 911, of course, right, if you think it's necessary. There's a really good picture in your book on puncture wounds. So a puncture wound, right, we talked about knives and gunshots. I guess you could fall anywhere and get stabbed by a lot of different things, but the main thing what we're doing is we're looking at the wound, and we can sometimes, like I said, hear that sucking noise with every breath. This person's situation could get worse very quickly. Without even, without care, this person's condition is going to really be compromised. We need to first call 911 for something like this. And we need to perhaps even give CPR, but our main thing is going to be trying to create an occlusive dressing to cover this large area, okay? We want to allow the blood to, I don't know, I guess you could say stay out of the wound, but we need to create some kind of pressure on the wound, a vacuum, so that way the breathing is better for the person. It's not so much of a sucking sound. We can protect that a little bit better. So we can make it's called an occlusive dressing. Now with an occlusive dressing, right, you're not putting gauze directly on the wound. You're still having gloved hands, obviously, but you're taking something like a square piece of saran wrap, right? And that piece of saran wrap is a piece of plastic, okay, about a 10 by 10 at the most. I'd say an 8 by 8 is usually pretty good. You put that around the edge, and then you tape the edges around it, except for the edge that would be closest to the ground, away from the body when you're lying on the ground, so the side. So if we're taping here, here, and across, here, here, and here, this would not be taped here, so the piece of saran wrap would be covering the position of the wound right there. We create some pressure, so again, that wheezing will go away. Perhaps they're getting better air into their lung then. It also then still allows that blood to come out of the wound a little bit though too, and keeps any debris from coming towards that wound, right? Anything from catching on it. Again, we call 911 immediately, first and foremost, for something like this. This is our primary objective. We care for that wound. We give CPR. if necessary, if the person stops breathing completely. If the object is still in the chest, we don't remove it. We want to keep that in place, keep that person still. Call 911, right? Be prepared to give CPR though. The only reason we do move an object or remove it is if it's impeding our ability to give life, meaning that we can't give CPR if this structure's in the way. That would be the one time to remove a structure to give CPR for a person that is not breathing, not circulating blood. The best thing we can do though with that object, if it's not causing life-threatening, right, death right away, they're not breathing, not circulating blood, we stabilize it in the position found. We put gauze around that wound, right? We hold in place, apply pressure at the edges of the wound, and then mainly we go ahead and pack it and wrap it so that way it holds those gauze in place, controls bleeding. And let's move on down to the abdominal moves, abdominal injuries. That's going to be below the ribs now. So we're looking at the ribs down to the pelvis almost. There's a lot of organs that are housed then just below the ribs. So if we look here, okay, my chest right here, we're looking at the bottom of our ribs, we have this thing called the xiphoid process. So just below that, we have what's known as the respiratory diaphragm. It's a muscular organ that's going to help with forceful breathing, and it's going to sit right here and divide the upper portion, the chest, right, from the lower portion, the abdomen. And in the abdomen, we're going to have a number of organs that could possibly be affected by a wound. Okay, so just to go through them, generally speaking, if you go ahead and put your hand on your left side and hand on your right side here. If you go to your left side, that's where your stomach is going to sit. And if you go to your right side, this is where your liver, with on the undersurface, is going to be the gallbladder then as well. The liver here on the right side of your body. If we move down then a little bit farther, we're going to get down to what's known as the intestinal areas of the abdomen. So we have the small intestines with the large intestines wrapping around, going down to the pelvic cavity. If we stay up here, okay, if we go back to where the stomach was, we look posterior to the stomach, and we have what's known as a couple organs, the kidneys, with the adrenal glands on top of them. And then we're also going to have, just behind the stomach, the pancreas, and then just up to the side of the stomach, there's going to be the spleen. The spleen is going to be a blood reservoir. It's important for our immune responses, right? We house a lot of white blood cells, technically, then in our blood, because it's got a lot of blood in there with red blood cells, and white blood cells are going to be mixed in, obviously speaking. So it's vital for cardiovascular as well. With this being compromised, right, that could be troublesome for the rest of the body. We look, again, posterior, like I was saying there. We had the pancreas. The pancreas is important for the body's utilization of sugar. We'll learn that here with sudden illnesses when we jump into diabetic emergencies. We move more anteriorly now. We go to the stomach. The stomach, we obviously know what the stomach is for. We move to the back, the kidneys. Again, those are usually protected by the ribs, but a kidney shot, all right, that can cause a lot of pain for the person. They could be urinating blood for all we know. Those are posterior in the body then as well, important for our filtration of our urine, filtration of our blood, not our urine. It makes urine. And then it's also going to be important for hormone responses then too, our blood pressure even from the kidneys themselves, as well as the adrenal glands. If we move then down, like I said, to the stomach area, what people call the stomach, where your navel is, you're looking at the small intestines. Those are going to be a portion of the body that helps us break down or absorb our foods. And then we get down to the large intestines, where we get portions where we're absorbing our last bit of water, ridding ourselves of all the toxic waste, obviously, to the latter end. These are some of the signals and serious abdominal injuries that we're going to look to. They're going to be things like very severe stomach or abdominal pain. There could be bruising to that area, so sometimes we have to do a visual check and see if there is internal bleeding going on. We can see that underneath the skin, actually. There's a good picture in your book. External bleeding of any kind is always usually considered pretty serious. There could be a small, basic gash or laceration. We could deal with those minor wounds. But if it's compromising the organ systems, right, if it's getting into the internal structures below the skin, right, into the spaces of the body, we want to make sure we're seeing those as possibly being serious and calling 911. If somebody has severe nausea, severe vomiting, vomit that contains blood, right, these are considered severe cases. If the person is severely pale, maybe like I guess it's like an ashen color. They could be very cool or moist to the touch. These are all possibilities that they're going through some kind of organ system shock failure. They could be very weak. They could be very thirsty as well. These are all symptoms of possible shock to whatever's going on. Other things we're going to look for is, I know this could be kind of gruesome thinking, but organs could be outside of the body, meaning there could be a tear to the abdominal cavity, and then the organs could be spilling out. If you've seen The Walking Dead, you should be fine with this, I'd hope to say then. But if you can imagine something like that, we don't want to take organs and try to put them back into place. That ain't our job. We call 911 immediately because that's a serious injury. We try to keep the person calm in the time being and not moving, right? Sustain life if necessary, giving CPR. Other things then too, okay? We don't apply direct pressure for those open wounds when it comes to the abdomen, mainly because it can cause sometimes objects to be pushed in. We don't want to put direct pressure on abdominal cavity because there's no bone there either, right? We're going directly into organs, so by putting that pressure on those organs, it can cause more damage to the structures than what's already going on. If there's anything ever sticking out, right, we don't reapply any pressure, obviously. We'd want to just lightly cover that wound in the time being with sterile gauze or a sterile blanket, just so there's no visual going on for you or that person at that heat of the time, because that could be a very shocking thing to see, and we want to keep everybody as calm as possible in that time being. So do look in your book. There's some good drawn pictures of this for obvious reasons, because this could be a very gruesome thing. The main thing is, right, stay calm, go back to your training. You call 911 first and foremost. They can always walk you through what to do sometimes if you're getting scared. For a closed abdominal wound now, the main things that we can always do for any kind of closed abdominal injury is carefully position the person on their back and then have them bend their knees. That can be a very comfortable position. So if they're lying down and with their knees bent, kind of like when we're trying to put somebody into the Haynes recovery position, we have to bend their knees at that 90-degree angle. That's a good position to put both legs. Again, don't put direct pressure on that wound directly. And if you want to, you can roll like a pillow up or some blankets underneath the person's knees just to keep them more comfortable with the positioning. Again, with an impaled object in the abdomen, just like when we were talking about eyes or other places, we don't pull out that structure. We leave it in place. We put gauze and we wrap the wound around it. We stabilize that item and we control bleeding, right? Pelvic injuries, let's move down to the lower aspect of the body. Down here, we're looking at the latter end of the large intestines. We're looking at the urinary system. And we're looking at the reproductive systems then as well for the human body. So again, these are very important structures as well. We want to make sure they're not compromised. We want to call 911 if necessary when these are severe. For any suspected severe ones, right, call 911 per usual. I know it's redundant, but call 911 when in doubt. Keep the person lying in the most comfortable position found, obviously, and look for obvious signs of external bleeding. We can go ahead and put direct pressure, hopefully, on a lot of these items. But some of these things we're going to want to be careful. For a male genitalia wound, all right, the main thing is that you want to be as careful as possible. You're going to care for it as you would with any other type of closed wound, assuming it's a closed wound. Technically speaking, you can have the person do this themselves, right? Have them wrap themselves and cover their genitalia so that way it is sterile, is in a safe position. I don't know. I don't see how this could happen unless somebody gets in maybe like a motorcycle accident and they hit their groin off their gas tank, or you're having a bad day with your girlfriend and you just were a bad guy. So that could be an injury. Anyway, cold compress. You get kicked, right? You take a basketball to the groin. What do? The family jewels, we protect them, we rest, we cold compress, we baby it as much as possible. We get back to playing basketball the next day if it's something minor. If it's major, we go see the doctor, right? When it's dealing with your genitalia, you want to make sure you're okay down there. Other things that with the male genitalia, when it comes to impaled objects, just like other things, we don't try to remove these things. We just try to control external bleeding if we can help that person in that time being. If there is an amputation of something going on down there or something's fallen out, right? We want to keep that with the person. We want to keep it sterile, keep it clean. We want to apply direct pressure to any kind of external bleeding, right? But we want to, of course, take portions of that avulsion or that completely amputated structure, put it in a plastic bag and keep it with that person when they go to the hospital, right, for the EMTs to take. Moving down to like the scrotum and the testicles, right? This could have an injury. Like I said, you get it in the family jewels, it can be very painful. Ice packs first and foremost. If the skin is broken, that's a good reason to go see the doctor, right? They might have to give you stitches or something like that. So we call 911 if necessary, if we can't transport the person safely. Control bleeding is very important with these things. For females, a little bit different, right? Not out, we're going in instead. We never put anything inside of a woman, okay? That is the one thing we never do in this class, right? Or in real life. We go ahead and if we're ever going to apply direct pressure to an external bleeding situation, right? This is a severe type of injury situation. Odds of this happening very slim to none. But we're going to be putting direct pressure with those gauze, with the glove bandages, with all those little things, right? We're going to applying direct pressure with protection. We're not going to put anything inside of a person, okay? If there's an impaled object, we don't try to pull those things out as well either, right? We leave that to the professionals. So the main thing that we can do is call 911, control external bleeding, keep the person comfortable, ice packs if necessary. Let's move on now. I think that's a good spot to stop. I'm going to pause this video. We're going to move to another one, so be ready.